Hello and welcome into the clinical chemistry lectures. In this lecture, I will talk about the plasma proteins abnormalities. This lecture is presented by Dr. Zuhair. Introduction. The total plasma proteins test is the measure of all the protein in the plasma. Total protein measurements can be reflect nutritional status, kidney disease, liver disease, and many other conditions. If total protein is abnormal, further tests must be performed to identify which protein fraction is abnormal so that a specific type of diagnosis can be met. Plasma protein disorders include low plasma protein, also known as hypoproteinemia, or increased plasma protein is also known as hyperproteinemia. Low plasma albumin is also known as hypoalbuminemia, and increased plasma albumin by mean hyperproteinemia and hyperalbuminemia. Increased plasma globulin by mean hyperglobulinemia, and when there is immunodeficiency and reduce or decrease plasma globulin is also known as hypoglobulinemia. Firstly, hyper or hypoproteinemia by mean hypo decrease protein in plasma. Total protein level less than the reference interval. Also, the normal range or reference interval for plasma protein from 5.5 gram to 8.8 gram per deciliter. So total protein level here in hypoproteinemia is less than 5.5 gram per deciliter. It also occurs in many conditions where a negative nitrogen balance exists. Low level of plasma proteins can be caused either by excessive loss or decreased intake. Plasma proteins can be lost by increased excretion of protein in urine or loss of protein in urine, such as in renal disease. Leak into the gastrointestinal tract by mean loss of albumin through GIT or gastrointestinal tract due to inflammation or other digestive system disorder. The loss of blood in open wounds and internal bleeding that by mean loss of plasma containing protein through the blood loss on the open wound and internal bleeding. Extensive burner. This also some of causes can lead to hypoproteinemia. Hypoproteinemia may be due to decreased intake and can be caused either by other causes such as malnutrition or malabsorption or through intestinal malabsorption. Amino acids and protein synthesis is impaired. Decrease in serum protein as a result of decreased synthesis is also seen in liver disease by mean that the liver is the main factory that can synthesize the majority of plasma protein. And inherited immunodeficiency disorders by mean globulins accelerated catabolism of proteins such as occur in burns, strioma, and other injuries. Hyperproteinemia that by mean increased plasma protein more than 8.5 or 8.8 gram according to the reference interval. An increase in total plasma proteins is not an actually disease state but is the result of underlying cause. Also, which condition can lead or cause of hyperprotein or hyperproteinemia It's also non-related to the disorder or disease by means that can relate it to the condition or a specific condition. One of these conditions can cause increased plasma protein, such as dehydration. When a dehydrated excess or access to water is lost from the vascular system, the proteins uh, become increased due to loss of water, and the concentration of protein rises in the ratio between water and protein. The protein become most increased. Remain within the blood vessels, although the absolute quantity of protein remain unchanged. The concentration is elevated due to decreased volume of solvent water. Hyperproteinemia due to dehydration may be result from a variety of conditions, including vomiting, diarrhea, excessive sweating, diabetic acidosis, and hypoaldosteronism. Hyperproteinemia may be a result of excessive production primarily of globulins, are characterized by the appearance of monoclonal protein or paraprotein in the serum by means that immunoglobulins, and often in the urine as well as hyperproteinemia. The most common disorder is multiple myeloma, in which the neoplastic plasma cell proliferate in the bone marrow. The paraprotein in this case is usually IgG-IgA or light chain of IgD and IgE paraprotein. Causes of high total protein: bone marrow disorder, multiple myeloma, amyloidosis, monoclonal gammopathy of undetermined significance, chronic inflammation or conditions which can lead to increase the immunoproteins or immunoglobulins or C-reactive proteins. All these immunoproteins can increase in the inflammatory process. HIV by means AIDS, dehydration, which may be make blood protein appear falsely elevated. Causes of low albumin level here by means specific albumin of total protein. The total protein also consists of albumin plus globulin. Lower albumin than normal level of serum albumin, and the normal level of serum albumin or normal range of serum albumin 3.5 gram per deciliter to 5.5 gram per deciliter. So when the albumin become lower or decrease, it's also less than 3.5 gram per deciliter, and this also may be a sign of kidney disease, liver disease. Decreased blood albumin level may be occur in your body does not get or absorb enough nutrition, such as after weight loss surgery, Crohn's disease, low protein diets, Weebles disease. Causes of high plasma albumin, and this is also rare condition and may be due to dehydration, high protein diet, having a towering gait on for a long time when giving a blood sample. By means here is a false technique or false increase due to bad technique or pre-analytical errors, such as using a towering gait for a long time, which can cause a venous congestion and make a plasma or serum more concentrated. So as here the towering gait and use the towering gait for a long time also give increase in all constituent of the plasma due to blood capillary congestion, which can lead to water move out from the capillary, and the plasma become more concentrated. Causes of low globulin level. Globulin by meaning immunoglobulins, 5 classes: IgA, GE, and D. And these the causes of low globulin level may be due to renal disease, hepatic dysfunction, celiac disease, inflammatory of bowel disease, IBD, acute hemolytic anemia, gamma globulinemia, and hypoglobulinemia can be caused by the globulin level to drop. Causes of high globulin by means increased globulin, and also the normal range of plasma globulin from 1.5 to 3.5 gram per deciliter. So the causes of high globulin by meaning more than 3.5 gram per deciliter caused by the leukemia, which give more immunoglobulins, or other bone marrow disorders, autoimmune disease, chronic inflammatory disease such as syphilis, Waldenstrom, macroglobulinemia, liver disease, rheumatoid arthritis, ulcerative colitis, carcinoid syndrome, kidney disease, or chronic viral or bacterial infection. All these causes can rise and increase the plasma globulin. Thank you very much. Here in this lecture also I mentioned the causes of increased and decreased plasma proteins, which include the total protein and albumin and globulin. Thank you very much.